One of the problems that some women face as they go towards the elderly age of around 55 and 60, or even in the younger generation, is having recurrent urinary tract infection. So the symptoms they have is burning in urine, which we call it as dysuria. There's an increased frequency, and all this sometimes can cause fever. In a young age, it happens, especially when someone is very sexually active. So this is usually seen post-coitus or post-intercourse, and we just advise them to take a low-dose antibiotics or take a pill after having intercourse. Women in the elderly age get it otherwise as well. The reason why women have UTI more commonly is the anal canal is very close to the vagina, and during hygiene conditions, occasionally the bacteria can go inside. So if someone is getting a recurrent urinary tract infection, we first examine the patient. We do a basic urine test, we do a urine culture, we see what bacteria is growing. We also do an ultrasonography to rule out other factors, because occasionally stones in the kidney, stones in the ureter or a bladder can cause having recurrent urinary tract infection. When everything is ruled out and it is as a simple bacterial infection, then the treatment is antibiotics for about 4 to 5 days. Occasionally we give a small antibiotic which goes on for 3 to 6 months. There are some babies who are born with a condition called vesico-ureteric reflux, which are also treated by giving low-dose antibiotics. So the antibiotic given to a child is same as that given to an adult. So even if a doctor prescribes you an antibiotic for 3 to 6 months, you should not be worried, because all you are trying to do is to keep the bacterial load low. So a recurrent urinary tract infection is really not a cause of worry. It can happen in women more frequently as compared to that in men, and it can easily be taken care by giving low-dose antibiotics. Occasionally, we also give probiotics which avoid constipation, and there are some extracts which come from the cranberry which decreases the chance of having a recurrent urinary tract infection. If you have burning, dysuria, fever, frequent symptoms, then do visit a urologist and seek professional help. Thank you.